Hi, I'm Dana. I've seen Justine actually after 3 different pregnancies and during one. I've had 2 vaginal deliveries and 1 cesarean, and I've just really been focusing on getting that pelvic floor back in shape. About 1 year after my first vaginal delivery, I was starting to feel a pressure and a bulging um, of a prolapse or something like that. And so that's when I decided to seek pelvic floor physical therapy to try and fix that. And then with my second, I was trying to position my baby appropriately to have a better vaginal delivery because it was a pelvic floor issue that caused a kind of a traumatic birth with my first. And so I was trying to fix that. So you saw me postpartum before I was pregnant with my second, while I was pregnant with my second, and postpartum with my third. I would say postpartum with my first, once I started feeling the bulging, it mainly was a self confidence hit to myself. It was something that made me feel less carefree, like I could jump and run with my 1 year old, that I could pick her up because she was getting so big. So, a lot of just self confidence in how I was feeling and knowing that something wasn't quite right. Once I got pregnant with my second child, I knew I wanted to take a more active approach to my pelvic floor in terms of positioning my child for the best delivery possible and for recuperating sooner after delivery with my second. And so I focused on that later into like probably I think my third trimester and a little bit postpartum with my second. Prior to seeing Justine for physical therapy, I had tried another physical therapist that I just didn't really connect with. It was out of a sports physical therapy office, and so it just seemed a little clinical. But other than that, it was just I felt it, I did the research, and I knew that this is what I needed to do. So after the first symptoms, after my first vaginal delivery, I waited probably a month to go seek pelvic floor physical therapy, and then probably about 2 months after that initial physical therapist to come see Justine. When I came to work with Justine, I got an overall approach to pelvic floor health. It wasn't something that was just like, hey, do Kegels, do vacuum breaths, and that was it. I got a good understanding of how all of the elements of my hips, of my round ligaments, of all of the structure of my core plays into my pelvic floor. And that made me feel a lot more confident with the help I was getting and better understanding what I could do to make things better. How I feel now is a lot more prepared for any bumps in the road I might feel. I don't want to say that I'm fully healed, but I definitely know what steps to continue taking and how everything plays into the pelvic floor. I also am a lot more aware of my pelvic floor and how I feel on a day-to-day basis when working out. So that may make me draw attention to it. But I would say I'm close to that 50 to 75% recovered from the worst I felt postpartum. After I have started physical therapy, I am just feeling overall better with the progression that my body is making towards healing itself, and feel supportive with all of the tools that I've been provided. Through physical therapy, I am doing exercises that help with the feeling of prolapse, that give me more confidence to maintain and progress into heavier workouts, whether it's high intensity or weightlifting, things that didn't necessarily feel comfortable prior to receiving treatment from Justine. Justine also allowed me or showed me uh, how to seek help from other doctors. So going to a urogynecologist and receiving a pessary. That was something that I didn't necessarily want because I felt like a failure, that I couldn't do all of these things without external intervention. But she really helped me understand that it was something that can be a supportive feature that we can phase out And I do feel myself phasing out the use of the pessary, but it really has helped me get back into the active parts of my workouts and playing with my children. I always assume that a pessary is just like, oh, we're just giving this to you until you have surgery. Like it's always the last resort, and it's really not. It's just a great tool. Like you said, like a knee brace. Yeah. It's something there to support you when you need support. I have actually had a few people in my life come to me because I'm very open about my experience with my pelvic floor and my postpartum recovery, um, stating that they've had similar issues, whether it was more along the incontinence side or the prolapse side. And I am hands down immediately go towards physical therapy. While most people aren't in the Colorado Springs area, I've had a few that I've directly referred to Justine to hopefully get the treatment that they want. I think it's a topic that needs to be more prevalent in the postpartum world, and I think it's becoming that way. But postpartum physical therapy is something that I tell every pregnant woman all about. Just before signing off, I just want to say that while I used Justine mostly for postpartum pelvic floor care, I did use Justine in the prenatal stages to help position my baby, to help a better delivery and relax my pelvic floor to make that a better situation. And it definitely helped have an easier labor and a more successful delivery.